A message brought to you by the Missouri Department of Health and Senior Services. Picture this. It's a nice sunny day. The lawnmowers are humming in the neighborhood. You're about to set up the sprinkler and water the yard. And the kids are ready to play in that water as soon as it starts. So you pull the old coiled hose out of the garage, walk it over to the wall spigot, and hook it up. You tell the kids, have fun. Hold it. Do you know what could be waiting inside that old hose? There could be a bacteria called Legionella, and it could make you sick. What is Legionella? Let's take a couple of minutes to talk about what Legionella is, the symptoms it can cause, who's at risk, and the simple steps we can all take to protect ourselves. Legionella is a type of bacteria that occurs naturally in fresh water, like lakes and streams. It's also present at low levels in our public water systems, and it can make its way into our building plumbing. It's a germ that thrives in warm, stagnant water, and it can multiply in things like garden hoses, hot tubs, hot water heaters, dormant pipes, household devices like portable humidifiers or CPAP machines, and even tools like power washers. If you breathe in spray or mist from water that's been sitting in a hose, a pipe, or a household device, you could develop a Legionella infection. Symptoms include fever, cough, shortness of breath, headache, muscle aches, and could even develop into a severe pneumonia. Everyone is susceptible to Legionellosis, the illness caused by Legionella, which can range from a mild cold or fever to a serious lung infection called Legionnaire's disease. So who's at risk? Some people are at greater risk because of their age or existing health conditions: older adults, smokers, and people with chronic lung disease, weakened immune systems, diabetes, or kidney and liver disease. More cases of Legionella happen in warmer months when conditions are right for Legionella to grow in water systems. But cases can happen year-round. A few simple steps at home can make a real difference. What can I do? There are several steps you can take right now to decrease your exposure to Legionella. Step 1. Take care of the devices in your home that turn water into mist. Use distilled or boiled water in portable humidifiers, CPAP machines, and similar household devices. Flush the tubing regularly with a cleaning solution. Vinegar works for many devices. Always follow your manufacturer's instructions, and when you're done, drain and dry the equipment. Standing water left between uses is exactly where Legionella likes to grow. Step 2. Clean what you can see. Scale, rust, and slime on shower heads, hose nozzles, and aerators give Legionella a place to hide. Unscrew them. Soak them in white vinegar for an hour or two. Scrub and rinse. If they won't clean up, replace them. A regular cleaning every few months goes a long way. Step 3. Flush before you use. If a faucet, shower, or hose in your home hasn't been used in 3 or more days, or if there's been a disruption to your water supply, run water through for at least 5 minutes before you use it. This is especially true for vacation homes and short-term rentals. A simple approach: run hot water at its maximum temperature for 5 minutes, then flush with cold water for another 5. Open a window so you're not breathing the steam. Step 4. Maintain your water heater. Keep it set to the temperature your manufacturer recommends, and don't let it drop below that. Once or twice a year, drain a few gallons from the bottom of the tank to flush out any sediment, which is exactly where Legionella likes to hide. And if you're heading out of town for a stretch, remember Step 3. The water in your pipes will cool down into the range Legionella likes. Flush before you use when you get home. A little maintenance beforehand will make sure that summer sprinkler, CPAP, humidifier, or vacation home keeps everyone smiling and doesn't ruin a good time. Stay safe and help keep Legionella from growing in your water. If you develop any symptoms, or if you think you may have been exposed to Legionella, see a doctor right away. For more preventative tips, visit health.mo.gov/watergerms.